Yeah, sure.
Good evening, everyone. Today's session is going to be really helpful and it's led by Dr. Smita V. Kalappa from Apollo Cradle and Children's Hospital. She is going to talk about safe sex practices and STI prevention. So stick around until the end and ask us questions if you have any. Let's not keep you waiting any longer. Doctor, you have the stage.
Hello, everyone. As she said, I'm Dr. Smita Karappa, and I'm practicing as a consultant obstetrician and gynecologist at Apollo Cradle and Children's Hospital in Jayanagar, Bengaluru. So every year, the 12th of February is celebrated as Sexual and Reproductive Health Awareness Day. So, in a country like ours, where everything to do with sex is associated with a lot of shame and fear and guilt, and also a lot of misconceptions around this sensitive topic, so we use an opportunity on this day to make you aware of what exactly encompasses sexual and reproductive health and what are your rights in this area. So, the World Health Organization defines sexuality or sexual health as a state of complete physical, mental, emotional, and social well being in relation to sexuality. It's not just a mere absence of disease, infirmity, or dysfunction. And this is complementary to reproductive health as well. So, what are the aspects that govern sexual health? Because having a good quality of sexual and reproductive health is a very integral part of your general well being as well. And this is important through all age groups, starting from your teenage years when you become aware of your sexuality and start engaging on this beautiful journey of achieving reproductive capacity, and through the reproductive years, as well as when you move on to your old age, having a good quality and fulfilling sexual and reproductive life becomes very important. So, what are the areas that come under this sexual and reproductive health bracket? So, it could be anything from knowing, having information about how to practice sex safely, how to prevent against sexually transmitted infections, how to get treatment, and what are the treatment options available if you should contract these infections. It could be information regarding sexual dysfunction, mental health issues associated with sexual dysfunction. Also, a lot of people are struggling with gender identity and sexuality issues. Some people have undergone the traumatic experiences of genital mutilation. So, all these areas come under sexual health. And when we talk about reproductive health, it has to do with the capacity to give birth, the freedom to choose when and how to do this, advice regarding family planning and contraception services, spacing pregnancies, also advice regarding avoiding unwanted pregnancies, and how to undergo safe abortion services. So, as you can see, sexual and reproductive health affects every aspect of our life, and there is a lot of reliable literature available online. I don't mean Google articles, and don't get waylaid by misinformation. But the World Health Organization, as well as the Ministry of Health and Family Welfare of India, a lot of material is published by these organizations, which are reliable and which you can go through. Also, having open discussions amongst family members as well as with your healthcare providers regarding your sexual and reproductive health issues can go a long way in making sure that you have a good quality of sexual and reproductive health. Now, coming to today's topic of discussion, I want to share some information regarding safe sex practices and what you can do to prevent the dreaded sexually transmitted infections. So, as the name suggests, sexually transmitted infections are those infections which are spread from person to person through sexual contact. So, this can be any kind of sexual contact. Most commonly, it is vaginal, but it can be through oral contact, it can be through anal contact, and frighteningly, it can spread. Some of these infections can spread even through kissing or just intimate skin to skin contact. So there are almost more than 30 kinds of bacteria, viruses, and parasites which have been identified to cause STIs. And it can affect any age group. In fact, these days a lot of people in the 15 to 24-year age group, especially in outside countries where sexual activity starts early, these are the this is the population that is getting affected by sexually transmitted infections. And the World Health Organization has found out that nearly 1 million people get infected by STIs every single day. And in India, you could say that almost 6 out of 100 people are having STIs. So it's a very prevalent infection, and it's a major public health concern. So, what are the common sexually transmitted infections? I'm sure you've all heard through various medias and movies regarding these infections. So, the easily curable ones are chlamydia, gonorrhea, syphilis, and trichomoniasis. And the non-curable ones, which can't be cured but there is treatment available, these are generally caused by the viruses like human immunodeficiency virus infection or the dreaded HIV infection, the HPV virus infection, and herpes infection, as well as hepatitis B virus infection. So these are some of the common STIs which we encounter in day-to-day practice. And as I was saying, this is it's very commonly affecting, anyone can get infected. And also these tend to be asymptomatic, so most of the times people are infected but they're not aware of it, or they have very mild or vague symptoms which get missed out on. And they don't know that they are having these infections, and also that they can spread these infections to their sexual partners. So being aware and getting information regarding these infections can help you to be more careful. Now, what are the symptoms that these can prevent with? What should you watch out for? So, generally, sexually transmitted infections tend to be asymptomatic, or as I said, there will be very mild or vague symptoms, but sometimes they do present with symptoms like discharge. You can get an abnormal discharge either from the vaginal area, or in men, it can come through the penis. Then there can be redness or swelling in the genital area. There can be some boils or warts which you see, or sometimes ulcers. These ulcers or blisters can come around your mouth as well, or inside the oral cavity. Then you may present with fever. There may be burning or pain when you pass urine. And also there can be pain in your lower tummy as well. Some women notice changes in their menstrual patterns, and infertility is also a symptom of sexually transmitted infections. So these are some of the ways in which these commonly present, and you should not be ignoring them at any cost, because it's important to understand that these are not just temporary infections. They can have long lasting impact on your sexual and reproductive health, as well as your general health and well-being. So some, as I said, these, when you have these symptoms, they can present with a lot of discomfort, and you will have to undergo treatment for them. Also they can lead to some congenital infections. So another way in which these STIs can spread is through mother to child. When the mother is infected during pregnancy, or they fall pregnant after they are infected, and some of them can lead to congenital defects in babies. They can present with preterm birth, stillbirth, and even after delivery, when there is breastfeeding and skin to skin contact between mother and child. These infections can lead to eye and skin infections in the baby. And the other ways in which they can spread, like blood transfusions, when infected needles are shared between drug abusers, and also if you get a tattoo or a piercing in unhygienic places, then also you have the risk of acquiring these infections. So, as I was talking about the impact of these infections, this is what happens when it have spreads from mother to child. They can also have pelvic infections in females, especially, and this can lead to infection of your uterus and your fallopian tubes, which can affect your reproductive health. Pregnancies can end up being ectopic, that means they are not inside the uterus, but they come in the fallopian tubes or outside the uterus anywhere, and this can be a life threatening condition for the mother. And long term, this can lead to infertility in both males and females. So, this is some of the long term impact. Also, some of these can turn into cancers. The human papilloma virus infection, if it remains inside the body for a long time, it can lead to cervical cancer, which is very common, and it can also lead to the development of warts and some other cancers of the oral and genital tract as well. And the hepatitis B virus infection, it can lead to cirrhosis of your liver, which is a chronic condition, and eventually leading to liver failure. There can also be it can also turn into cancer of the liver. So these infections are not harmless, and they can have a long term impact, which is why you should be extremely careful of acquiring them. And of course, the most dreaded, if you acquire the HIV virus infection, it can lead to AIDS illness, which is a lifelong illness with no known cure, although there is treatment available to manage the condition. And syphilis can affect your internal organs and your brain as well. So, this is the impact that STI can have on your life. So, what are the ways in which you can prevent these sexually transmitted infections? So, that comes to the next part of my topic, safe sex practices. So, the first and foremost, to be blunt, no sex is the safest option, or abstinence is the only true form of safe sex. I know, practically speaking, that's not great advice, but yeah, if you refrain from sexual activity, then you can be sure that you are protected from sexually transmitted infections, because any form of sexual contact, even close, intimate skin to skin contact and kissing, can spread some of these infections. Now, coming to what are the steps that you can take. So, information is power. Give the right kind of information to your to our youngsters. Have open and honest discussions with your kids, and face the fact that it's not just outside India. Everywhere now, kids are engaging in sexual activity at a very early age. So you'd much rather empower them with the right kind of information than to keep them in the dark and let them face these consequences. Sex education should be a very important topic to be covered in schools and colleges. And not only that, every parent has the responsibility to provide the right kind of sex education to their kids, so that they whatever they do so with the right kind of knowledge. So sex education and education regarding STIs and how they are spread is the first step we can take to prevent these infections. And also, delaying your sexual debut. No matter how casual we get about engaging in sexual activity, you have to know that the more you delay, the more you give a chance to your reproductive tract to be fully functional and mature, the safer you will be in terms of contracting these infections. So delay your sexual debut. Also, be open and honest with your partner regarding your sexual activity. What are your sexual practices? If you have any signs of STDs, if you have taken treatment in the past, be open about it with your partner so that they can also make an informed choice. It's always a good option to meet with your gynecologist or any trusted healthcare provider. Discuss with them that you are planning to start sexual activity, and take advice regarding what tests you can undergo. There are some blood tests available which can be done to ensure that at least the major sexually transmitted infections like HIV or hepatitis are not there in either of you before you start engaging in sexual activity. The other step is to limit the number of sexual partners. So choose to have sex with someone who chooses to have sex with you, and have protected intercourse. This is the message I would like to drive home, because being in a trusting and long term relationship with a single partner can go a long way in making sure you don't encounter these sexually transmitted infections, or that you are not at risk of infection every time you start a sexual activity with a new partner. And as I said, always, if you get the chance, get tested. So if you visit your gynecologist regularly, we can do a pelvic examination. It's also good practice to get regular pap smears done. And if there are any signs or symptoms, we can send some blood tests, and some swabs can also be sent to identify if you have any sexually transmitted infections. If you should get diagnosed with these infections, then there is treatment available. So take the correct treatment at the proper duration advised. And it's not just for you, your partner may have to be treated as well. So again, being open, being honest, especially with your doctor as well, so that they can guide you correctly, and your partner can get treated as well, so that you don't keep reinfecting each other, or god forbid infect someone else. So make sure that you are communicating properly and get the necessary treatment for the full recommended duration. Along with that, maintaining hygiene. So hand hygiene, oral hygiene, hygiene of your private parts can go a long way in preventing STIs. Always wash with soap and water before you engage in sexual contact, and even afterwards. It's always a good practice to empty your bladder and wash your private parts as well. But for females, it's important to know not to douche inside or wash inside the vagina, because that can help the infection to spread higher up your reproductive tract, and that's not a good practice because it alters the vaginal flora as well, which actually protects against infections. So wash regularly and maintain hygiene. Always wear loose fitting breathable cotton underwear, and yeah, as a general measure, you can also work on your general lifestyle, like having diet rich in fruits and vegetables, engaging in regular exercises, as this can boost your immunity and your general well-being, and that can have a good impact on your sexual and reproductive health as well. So along with that, a word on sex toys, the usage of which is becoming very common everywhere. So if you are in the habit of using sex toys, make sure to keep them clean and well maintained, and these are private, not to be shared with other people. And always at every new sexual encounter, you make sure that you use a condom on them. So there are male condoms, female condoms, and even oral or dental dams available. So the best ones are the ones made of latex or polyurethane. So the natural material condoms may not be that effective in preventing STIs. So make sure you use latex, and if you're allergic to latex, then polyurethane condoms should be used. Using them along with spermicidal gel is also shown to reduce the spread of sexually transmitted infections. So this is something you can follow. So always when you engage in sexual contact, make sure it is protected, because the right and consistent usage of condoms may not prevent against all STIs, but the common ones are definitely preventable. And also it goes a long way in preventing HIV, which is a life-threatening condition. So regularly use condoms, always have protected intercourse, maintain good hygiene. There are some vaccines available which do not prevent against STI, but the impact can be avoided, like the cervical cancer prevention vaccine or the HPV vaccine. If taken at the right time, can prevent the formation of warts, and can later on prevent the formation of cervical cancer. And hepatitis B vaccine, which is universally given to children all over, but booster doses in adulthood may be needed as well. So these are a couple of vaccines which can also be used in this fight against STIs. And these are some of the measures which I hope you find helpful, and I hope it helps you in making the right choice and keeping yourself and your partner safe. So thank you everyone, and if you have any questions, I'll be happy to take them now. All right, looks like no questions. You're always free to book an appointment with us, or get in touch in the comment section, and we'll get back to you. Thank you, everyone.